Good morning, everybody, and happy Friday. I am Bree Mullins, NEDA's National Walks Senior Associate, and I'm really excited to be here this morning with my colleague, Liz. Liz Altunkara is the Helpline Manager at the National Eating Disorders Association. She has been with the organization since 2014 and works with her team to build a robust training for Helpline volunteers to provide quality services, as well as expanding the Helpline's reach and resources over various platforms to help individuals and families affected by eating disorders. Liz is a licensed Master Social Work, LMSW, who has also experience in the treatment of eating disorders. She has received her bachelor's degree in psychology from Princeton University and her master's degree in social work from Columbia University. Welcome, Liz.
Thank you. Thanks for having me, Bree.
All right. So I wanted to kick off this little session to just tell us a little bit about your role, NEDA Services, and our partnerships.
Yeah, absolutely. So for the last 6 years that I've been with NEDA, I'm working on the helpline within various capacities. And I currently oversee all helpline operations and services and resources. So our team consists of staff member, including myself, and also our volunteer program supervisor, who is helping us with volunteer recruitment and other tech services, and our 70+ volunteers. So I just want to thank our awesome volunteers for their hard work and dedication to our mission. We cannot do the job that we currently do without their help. So let me talk a little bit about Helpline Services here. So we offer information about eating disorders, provide general support, and help people find treatment options specific to eating disorders. So we believe that specialized care for eating disorders is very important because disorders are such complex issues. And so that's what we help individuals who contact us with. Call our helpline. We have a helpline number, or they can chat with us online, or they can also send us a message on Facebook and we'll respond to them. And there are a few other services who are kind of under the helpline umbrella, and one of them is our online forums. Our online forums are on our website. They're accessible 24/7. And they are moderated by trained volunteers, and they are kind of trying to provide the safe environment where people can get and receive support. We also have an online screening on our website, so it's important to note that this is not a diagnostic tool, but it's a great tool to determine if it's time to seek professional help. So it could be, we always recommend professional help at the very first sign of an eating disorder or disordered eating. So it could be a helpful tool for people to kind of figure out what's going on. And we also have a treatment map on our website. So what that means is we have a database of professionals and treatment centers that specialize on eating disorders. So people can go to our website, plug in their zip code, and see what's available in their area. And they can always contact our helpline as well, and our trained volunteers will be happy to help locate services. And you also asked about our partnerships. So briefly, we have a strong partnership with Crisis Text Line. I'm not going to go too much into detail about it because Lauren Smoller, our Senior Director of Programs, just had an interview with the connection. And if anybody is interested, they're welcome to watch that video. But basically, if anyone who contacts us is going through a crisis, any kind of crisis, they can text NEDA, N-E-D-A, to 741-741 to get connected with a crisis counselor. We also have partnerships with Recovery Record, which is an eating disorder app. It's evidence-based both for professionals and for patients, as well as 18%. So 18% is an online community based off Slack, and they have channels for various mental health issues. One of them is eating disorder. So they also provide this moderated environment where one can receive live support. And I also would like to mention NEDA Services and other great eating disorder organizations that we work with. They also have online support groups and recovery mentors, and their information can also be found on our website.
Awesome. I do want to just circle back to the treatment map. I've looked at that a couple times, and it's really awesome and really
Mhm.
helpful for anyone, anywhere, which is part of our mission, reaching everybody in every zip code. I also wanted to talk a little bit about the trends from COVID-19 that you touched on in our staff meeting earlier this week. Could you expand on that a little bit?
Yeah, absolutely. I mean, March has been kind of an interesting month for our helpline. At the beginning of March, we were busy because it was kind of the end of our NEDA Awareness Week, and that's when, our volume really picks up. And then in the middle of March, and this was when, COVID-19, this started to become serious, and this, all the stay-at-home orders started coming in. That's when things got slower. So we were thinking people filling in, and this is a new way of living. Everybody is getting used to it. Our volume dropped a bit, but since then it really picked up, and especially our chat volume increased a lot compared to our phone volume. And this kind of makes total sense for us, and we also confirmed this with other hotlines and helplines. It seems like people don't feel as comfortable making phone calls when they are in a confined space with others, so they prefer, the chat option, which gives a little bit more privacy. So we've been having a lot of chats, and also another trend that we've observed was the increase in domestic violence and child abuse situations. It's always very sad to hear about this incident, but this is again, because of the living situations that people are in. And we also confirm this trend with other hotlines as well. And anytime anyone contacts us with these, issues, we always try to connect them with the crisis line or a helpline that could better help them with these issues.
Yeah, that's all like very interesting. I it's really sad and really difficult, I think, for everybody during this time. But it's really encouraging to see that people are still reaching out, and that we are there to help them and to guide them in the right direction. And I also wanted to know if you could take a little bit of time to talk about our resources that are for COVID-19 and just what we've compiled to provide to our constituents.
Yeah, certainly. I think the first thing that I'm going to bring up is kind of our treatment map. We've been getting a lot of questions from our contacts about treatment facilities, like what are they doing with their programming during this time. So we have a list of treatment centers that are offering virtual programming on our website. So it's linked from our treatment map. And then this is a running list. So we are updating and adding to this list the more we hear about treatment facilities or site services. So that's one thing. And the other resource that we put together is the COVID-19 Resources page. And anyone who goes to our website, nationleadingdisorders.org, the box pops up. They can directly call to that page, or it's under Help and Support tab on our website as well. So basically, there are a few options in there, and I'm going to briefly go over them. The first one is our NEDA Connection series. I mean, this is a great way for us to check in with our community every day, and also for our community to hear about, NEDA programs, to hear from NEDA staff, volunteers, as well as eating disorder professionals. And, there's always a helpline. Please feel, anyone can reach out to our helpline, general support information, and we can always guide them to these COVID-19 resources as well. We've also created a COVID-19 forum. So this forum is specifically a safe space for people who are kind of struggling with the added challenges that this pandemic brings. We thought that it would be helpful for people to have this separate forum to discuss these issues. And another resource that we have listed in there is the list of virtual support groups that our NEDA network members put together. NEDA network is a partnership between NEDA and other mission-aligned organizations. So most of their in-person support groups are happening virtually now, and then they put this together so that people have access to that resource. And on that, we also have an Instagram account where, eating disorder professionals are offering meal support throughout the day. And then we also have links to the other resources that I talked about, 18% recovery records, and the ANET resources, and as well as the support group, the virtual support group that the Alliance for Eating Disorder Awareness is offering.
Awesome. Well, thank you for all of that information. Is there anything else that you would like to share with our community before we say goodbye for the weekend?
Yeah, I mean, I just want people to know that we are here. We are here for you. Our helpline has been operational remotely since the end of last year. So we have our whole group of volunteers who are ready to help. You don't have to go through this alone. Please reach out to us, chat with us, call us, send us a message, and we'll be happy to get back to you. I guess I'm just going to finish with our helpline information. Our helpline number is 800-931-2237, and people can go to nationeatingdisorders.org/helpline to chat with us online. Our 11 a.m. to 9 p.m. Eastern Time Monday through Thursday, 11 a.m. to 5 p.m. Eastern Time on Fridays, and our chat hours are 9 a.m. to 9 p.m. Eastern Time Monday through Thursday, and 9 a.m. to 5 p.m. Eastern Time on Fridays. And thank you for having me today, Bree.
Yeah, thank you for taking the time. And we will see you guys next week. Bye.